Madam Speaker, today, as we all know, is an historic moment for our nation and for America's families. For nearly centuries, leaders of every party and political philosophy have, as far back as Teddy Roosevelt, have called for health care for the American people. For generations, the American people have called for affordable, quality health care for their families. Today, the call will be answered. Today, we will pass the Affordable Health Care for America Act. This legislation is founded on key principles for a healthier America: innovation, competition, and prevention. It improves quality, lowers cost, expands coverage to 36 million more people, and retains choices. Our innovation began in the recovery package in January with $19 billion for health IT, the first step in lowering cost and improving quality, and $8 billion investments in biomedical research. This legislation will mean affordability for the middle class, security for our seniors, and honors our responsibility to our children, not adding not one dime to the deficit. For all Americans, this legislation makes a big difference. No discrimination for pre-existing medical conditions, no drop coverage if you are sick, no co-pays for preventive care. There's a cap on what you pay in, but there is no cap on the benefits that you receive. It works for seniors, closing the donut hole, offering better primary care, and strengthening Medicare for years to come. It works for women, preventing insurance companies from charging women more than men for the same coverage. No longer will women, being a woman, be a pre-existing medical condition. It works for young people, offers affordable choices, ends co-pays for preventative care to stop the problems before they start, and allows young people to stay on their parents' premium until their 27th birthday. It works for small business owners, providing access to affordable group rates and creating a tax credit for them to help them insure their employees. It works for consumers, keeping insurance companies honest and encouraging competition with a public option. This legislation puts you and your doctor in charge. No longer will the insurance companies come between you and your doctor. President Obama has said that health care reform is entitlement reform, and this legislation proves that point. It is fiscally sound, it is paid for, and it reduces the deficit by tens of billions of dollars over the next 10 years. This legislation is a result of extensive deliberation here in the Congress, where we've held more than 100 hearings, and is a product of extensive input from the American people. Members of Congress have held over 3,000 town meetings, and it has resulted in a better bill than H.R. 3200. However excellent that was, this bill is a better one with significant differences, and my colleagues have pointed them out. Congresswoman Dina Titus just before me at the podium. We are brought to this historic moment in our nation and for our families because of the work of our chairman. Chairman Henry Waxman of the Energy and Commerce Committee, Chairman Charlie Rangel of the Ways and Means Committee, Chairman George Miller of the Education and Labor Committee, and Chairwoman Louise Slaughter of the Rules Committee. I thank all the members of those committees, including the Rules Committee, for being in so late so that we could have this legislation on the floor today, and for their ongoing service to the Congress. And more than 300 groups representing tens of millions of Americans have expressed their support for the bill. AARP, the American Medical Association, the American Nurses Association, the list of medical groups goes on and on. The American Cancer Society, Cancer Action Network, American Heart Association, American Diabetes Association, and I'm particularly proud that Consumer Union has endorsed the legislation. My colleagues, this morning we were part of history, and we are this evening as well. But a particularly poignant moment occurred when Chairman Dingell took the chair to preside over the debate, the beginning of the debate for health care. When he was a young man, as a member of Congress, he gavelled Medicare into law. It had been, as one of our colleagues said, is in his DNA, this pursuit of health care for all Americans. His father had introduced the bill over and over again when he was in Congress, and as his successor, he continued that great legacy. Today, he will see a lifelong dream of generations in his family come true as we begin the process of making this a reality. It is impossible to talk about health care reform in America without talking about Senator Edward Kennedy. His leadership and his contribution to this debate is boundless. Health insurance reform was the cause of his life. He called it the great unfinished business of our society. On this issue, he said, "What is at stake is the character of our country." Remember when the president came to address the joint session, he quoted those comments by Senator Kennedy from a letter that the senator had sent to him. What the senator also said in the letter was, that was sent to President Obama before he died, was this: when I entered public life with a young president who inspired a generation and the world. It gives me great hope that as I leave, another young president inspires another generation and once more, on America's behalf, inspires the world. He acknowledged President Obama's, quote, unwavering commitment and understanding that health care is a decisive issue for our future prosperity. President Obama's leadership gives our nation hope. Today, with this legislation, we will give them health. President Obama has said, we will measure our success by the progress made in America's working families. Today, with the passage of Affordable Health Care for America Act, we will make history. We will also make progress for America's working families. I urge my colleagues to support this important legislation.
Thank you.